Once your loved one leaves the intensive care unit and is in a general ward in the hospital, they may continue to have tube feeding or IV nutrition, even if they have begun to eat and drink on their own. You should encourage your family member to keep the feeding tube in place, as it is still an important part of their treatment. You can help to ensure that your family member is getting enough nutrition by talking to the healthcare team and keeping track of how much your family member is eating and drinking. This is important as there are fewer nurses per patient in the general ward of the hospital compared to the ICU, and so the nurse will not be able to dedicate the same amount of time to your family member. If there are concerns about your family member's ability to swallow safely, they may be assessed by a speech-language pathologist to ensure they can chew and swallow safely. If you find they are having difficulty chewing or swallowing, please let the healthcare team know, as the texture of the food or fluids can be changed to make it safer for them. If they are eating by mouth, they may be given a special diet, which may have some restrictions. For example, it may be a diabetic diet or low-salt diet. If they aren't eating and drinking very much, nutrition supplements can be added to their diet to help provide calories and protein. Research has shown that older patients should have at least 2 servings of oral nutrition supplements each day. This is usually served as a meal replacement shake. You can speak to the nurse or the dietitian about having this added to your family member's diet. If you are unsure about how much nutrition your family member is getting, you can ask the nurse or dietitian. You can ask questions like, "Did my family member eat their meals today? What type of diet are they on? How much of their meals are they eating? Can I bring in food from home? Are there any foods that are not safe for them to eat? Has my family member lost weight in the hospital?" If they aren't eating well, ask if there's a reason that you should know about. For example, are they nauseous, having difficulty swallowing, or too tired to eat? Do they need help with eating? You can help by encouraging your family member to eat small amounts often, and by being at the hospital during mealtimes to see how much your family member is eating. Consider bringing in food to the hospital and joining them for a meal to make it more enjoyable for them. You could also write down how much they are eating and drinking so that you and the healthcare team can keep track. Record each item along with the amount they ate. For example, if they ate half a muffin, write muffin and 50%. Or record the percent of the entire meal that your family member ate and any oral nutrition supplements they had. If you are concerned about your family member's nutrition, ask to speak to the dietitian who can help to answer your questions. It is common for patients to eat less in hospital, and it's important to remember not to force your loved one to eat. If needed, the dietitian can help optimize their diet in hospital. Remember to adhere to any diet recommendations to ensure your family member is eating safely. Proper nutrition in the hospital is a very important part of helping your family member recover. By staying informed and asking questions, you can help the healthcare team provide the right care and ensure that your family member receives the nutrition they need to get better.